Okay, so now I'm going to talk about the knee joint. I'm going to focus first on the osteokinematics of the knee joint, and at the knee joint, which is the articulation of the tibia and the femur, so people will call it the tibial-femoral joint. The primary movements are extension and flexion, and you also have some internal and external rotation. Okay, so we talk about open and closed chained flexion and extension, and when we talk about the tibia moving on the femur, that's going to be open chained movements. So if it's moving anterior like this, that's going to be extension. If it's moving posterior, that's going to be flexion. When we talk about rotation, open chained external rotation, we define that by where the tibial tuberosity is in relation to this anterior part of the femur. So for open chain rotation, okay, the tibia is going to move out like that. It's going to rotate outwards or rotate laterally. So that tibia is actually lateral to the anterior part of the femur. Okay, but notice if it's closed chained, okay, if the femur is moving on the tibia, if the tibia is fixed, so if your foot is on the ground, that femur is going to rotate inwardly, and that's going to make the tibial tuberosity lateral. Okay, so this is still going to be external rotation at the knee. Okay, we define the rotation by where the tibial tuberosity is in relationship to this part of the femur. So that can either be the tibia moving itself, moving laterally, so that the tibial tuberosity is going to be lateral, or that can be the femur moving internally. Okay, so notice that even when the femur moves internally, you still have this tibial tuberosity that's lateral. Okay, so going back to the Artha kinematics, you have the convex femoral condyles, and then you have the concave tibial condyles. So in open chain movements for extension and flexion, you have the concave tibial condyles going on the convex femoral condyles. Right? So concave on convex is always the roll and the slide in the same direction. So for extension, tibia on femur, that's going to be an anterior roll and slide, and for flexion, it's going to be a posterior roll and slide. When you talk about closed chained flexion and extension, okay, so the tibia is fixed, okay, the femur is moving on the tibia. Now we have convex and concave, and so remember that you still have the roll is still in the same direction of the bone, right? So when I go into extension, my femur is moving anteriorly. So the roll is anterior, but now I need a posterior slide to keep it in the joint, okay? So when we talk about closed chained femur on tibia motion at the knee, okay, so for example for extension, it's a anterior roll and a posterior slide, okay, and then flexion will be the opposite, where you have a posterior roll and an anterior slide. And those are the orthokinematics of the knee joint.